Welcome back. We just found out that you need therapy. Dr. Acey, how do you find a therapist?
Well, it's hard to go about the process of finding the right fit therapist because it's the kind of thing that people, I think, feel uncomfortable asking their friends or their colleagues because they feel like there's some stigma attached to it. But that's really a good place to start if somebody thinks they need to see a therapist or someone in their family would benefit. If you feel comfortable with somebody, ask. If you know somebody or are lucky enough to know someone who is a therapist, you can ask them for referrals. You can ask your primary care physicians. And sometimes it just comes down to what your insurance can cover.
So should you, if you think that you need therapy, obviously maybe you should see your regular physician first, and then they would say, well, maybe you need therapy, and they would give you referrals, or should you call your insurance company and say, you know,
can call your insurance company. I mean, I think asking friends, colleagues, I think, frankly, people who deal with a greater population, hairdressers. I think that there's people who have, relationships with numerous people. If you know somebody that's a therapist, if you feel comfortable with somebody, starting with your primary care physician is, if you really feel comfortable with them, then it's a great place to start because wouldn't you ask your primary care physician for a referral for a dermatologist or a specialist?
Well, okay, as just a regular everyday person, I would be totally lost trying to find a therapist. I would just be like, I don't even know where to start, how...
Well, you would call me and I would help.
Well, I would call you. Now that I know you, I would call you. But 6 months ago, I may have went to my doctor, but I feel that my doctor would prescribe like an anxiety pill or something.
Oh, I see.
Instead of referring you to a therapy. Maybe, like, what's the difference between having anxiety and needing a therapist?
So just somebody who's having a bad day or someone who's having... And
right.
especially...
Or feeling anxious?
Well, in today's economy and what people are going through on their day-to-day, there's a lot of anxiety on the day-to-day. When does it become a clinical issue? Is it?
Yes.
I think that, there's a diagnostic amount of time where someone is just going through a stress period, and then it, technically becomes a clinical issue. But I think that, it's so beneficial to curb it before it gets to that point. And so it almost doesn't matter. But if it's been going on for a long time and someone's been suffering with stress, they might not even know that that's stress. They might not even know that the waking up in the middle of the night is stress related, or issues with stomach pains or headaches. Sometimes we don't know that that's a psychological issue. And I think that if you're wondering about it, if anyone's wondering about it, talking about it, even just having an evaluation with a psychologist, can sort of sort those things out. But in terms of your initial question, how do you find one? If you're lucky enough to know someone who's a psychologist as a friend or as a colleague, you don't necessarily go see them as your therapist, but they might know other people. If you have doctors in your life, whether it's a gynecologist or a primary care physician, but some other doctor somebody likes enough and has been going to long enough and likes how they work, probably the kind of people they'll refer you to are the kind of people that you'll feel comfortable with.
Okay, so now we've determined that you need therapy, how to find one. How often do you go?
That's tricky too, because, it depends on the type of issues. And the type of situation, sometimes people are court ordered for therapy, they have to go for a certain amount of sessions. They have to go for groups. They have to go for different treatment programs. If we're talking about outpatient psychotherapy, in my practice, I think it's helpful to go weekly. Or it depends on really what's going on with the person and in their lives. But think about it as a friend. If you meet somebody and you don't see them for a month or a few weeks, it's hard to reconnect. And we're talking about a clinical relationship that you're building. So I think weekly, at least in the beginning, for me, is helpful.
Okay, so now we've determined that you're going to go once a week. And now you're in therapy, who does the talking? Does the patient do the talking? Does the therapist do the talking? How does the dynamic work between the
It's a good
patient and the
question.
doctor?
It depends on, usually it's obviously the patient's time or the client, depending on how you want to refer to them. But
Do you call them clients or patients?
Client is what I would refer to it as if I was left to do that on my own, but there's a lot of insurance and paperwork and sort of how things have to be worded in our world. And I've sometimes have to write patient, but client would be my preference because I think it's a mutual relationship as a therapist.
So do you find that when a client comes in, most of them just they don't even know where to start, or do they come in and start going, "Oh my God, this and this," they just start babbling on, or do you have to kind of pull it out of them?
Who does most of the talking? Because I
Right.
prefer that somebody would come in and want to share what was going on with them and take their history and hear what they had to say. But as I said, I work with a lot of teenagers, and a lot of times it's scary. I think
Well,
for
okay,
adults
so
too,
you
to
work
come
with
in,
a
they don't know what
teenager.
to say.
You work with teenagers, and I know I have teenagers. I know that no teenager on their own would ever decide that they need therapy, so they're being sent there by their mother, and they're going to come in and do the, I'm not speaking, so how does that work?
Well, that's the hard part. That's the part about who does the talking. And I truthfully, even though I do work with a lot of adults and teenagers who really do want to come, it's hard. It's hard to make that first step, and it's hard to come in the door. And I think they need some help and some guidance. And sometimes, depending on how enthusiastic, I guess, they are about the sessions, they need more guidance. And I think that I personally think it's the responsibility of the therapist to help bring that out. It depends on the therapist's orientation and their training, because there are some, you're right, there's some orientations and training orientations where the therapist would say nothing and just sit there and look at the person for an hour. That's not how I work, obviously, because I work with teenagers, and I think that some questions, and I think what to expect in an initial session hopefully would involve a lot of good guided questions and good interviewing strategies from the client, about what's brought them there today.
Well, that was going to be my next question about how you would start initially, the first time a patient or a client comes in, how would their first session be? But since you kind of answered that already, how long is a therapy session usually last?
It's funny because people get into an issue sometimes about time and how long somebody is given them in a therapy session. And generally, for me personally, I block half an hour for each client. But 45 minutes to 50 minutes is the typical therapy hour because there's notes to be done.